even too like this, like, you know, I can tuck into here, I can tuck into the bra straps, pull it to the side, right? And then especially too, when they have those, the ones that are like this or across like this. So what I'll do with that, this isn't a great example of this, but you'll get the idea. So what I'll kind of do is I'll tuck under here and I'll just like pull it all to the side, or like, you know, it depends on the type, or like pull it up like this, whatever I got to do to get it out of the way so I can get in there. So that's kind of why. And then, you know, protects their nice clothing as well too and stuff like that. Okay, so thank you for that. That's all I needed for.
Yes. Ask them for permission when you go on.
Yes, I do. Yes, and I do ask for permission. I'm like, yeah, I'm just gonna tuck this in here. Is that okay? And then I'll check in it again, and I'll be like, oh, is that comfortable as well? Yes, but I do ask permission. I do ask consent. Yes. Sorry, I didn't ask consent there. Okay. Okay. So, Quinn, just hop back on the table for me, please. Face down. We'll go. Okay. So now we'll just kind of talk about like some general CIs. So yeah, so Quinn, slide down the table for me, please. Ankles, we want ankles off the table, right? And because we aren't doing work without any pillows, so things like compressing the knee are also a CI. So you know, we're kind of doing our general compressions. This is okay, but then it's kind of when we get over like to here and like long lever and like, so you're almost like cranking the knee backwards like this. So then that would be a CI, right? Because that's not very comfortable there. And then Quinn, go face up for me, please. Then where it's, you know, where you can see this a little bit more is when you're pressing down on here, right? This isn't comfortable. Even too, I find a lot, like when I get treatment and if I'm getting like quads or like my knees done or something, even sometimes a pillow isn't enough, right? And I am, again, sports treatment, a little bit of the Wild West, like I am kind of like all over my patients. So sometimes too, if I don't have a pillow, I'll tuck like this, my knee under this, and then do my work. Obviously for school, like, you know, there's different procedures, right? Asking consent, putting a towel under there, but sometimes, you know, you're just in it, right? So you're doing this. Okay, so let's get into, sorry, you're gonna go face down. Okay, let's go into pre-event. So we talked about pre-event, right? The example, well, I'll still use this example, right? Someone coming in, they have, you know, swimming practice, they got an event in the morning, they're coming in tired, right? So anyone remember some of the techniques that we were talking about? Deployment, okay. But how are we structuring our treatment here?
Soft tissue.
Yes, but how about speed? How about speed? Speed, rate, rhythm. Are we starting fast?
Slow
We're
too
starting
fast.
slow, right? So we're starting slow. So like, you know, this is kind of where we kind of just gonna go with our traditional kind of massage treatment. And then from here, I'll kind of do like a little bit compressions, like assessment, and then I'll probably like get in a little bit faster and start with the shaking and things like that, jostling. So then maybe I'll kind of, this is where we're kind of getting into that mobility, jostling the arm, right? Things like that, waking them up. And then we're kind of getting into the movement, the passive range of motion, things like that. And this is just kind of non-specific, right? So now going to go face up for me. So starting very slow, getting into the jostling, the shaking. And this is kind of where too, then we'll kind of get into the activation. So some things I like to do for activation is especially, my favorite too is like, so resisted range of motion is great. So like the, don't let me move you, don't let me move you, don't let me move you. So resisted range of motion is great, but I'm a fan too of the proprioception stuff, right? So Quinn, keep your arm here, don't let me move you, okay? So things like this, right? Waking up those muscles, activating, right? And I'm pretty much almost to like, I like to activate the core almost like every single treatment. So like I'll do things like this. So like cross your arms kind of like this, elbows up, knees up. Yeah, like knees up, off the table, tabletop, there you go. So okay, don't let me move you, okay? So we're gonna brace that core, push into me, and I'll kind of add in, don't let me move you, kind of add in a little bit shaking, right? Waking up that core there, right? Things like that. So just not a lot of techniques to show necessarily, right? You kind of have to structure it as your own, but that's how I structure it. Start with the soft tissue, start going slow, then kind of get into the shaking, jostling. Oh yeah, well, I will show one more thing, go face down. Sorry, I'm gonna do a lot of stuff in today. So also too, I think you might call it different things, but I also try and go for like the direct shaking and the indirect shaking. So let's say, for example, I'm trying to warm up the thigh or the leg. So I'll kind of start with the indirect, kind of getting things going, things shaking, and then I'll kind of directly get in there. So that's when I'll kind of pick up the tissue, kind of get going, shaking, things like that, right? So I try and do the direct, indirect as well, okay? Same thing too on the arm. I'm not gonna get you to flip again, but like shaking the arm and then getting into the muscle belly there as well, okay? The direct, indirect. So in terms of post treatment, so let's use the example like we did with the runner, right? So they're just finishing like crossing the finish line, and they're still, oh, I just finished the race. Okay, there's a massage. They're like, can I get a massage? Right? So what I'll usually do with someone like that who just finished the race is I'll be like, okay, you know what? Go walk around, like whatever, go to the snack station, get some snacks, come back when you can, like, you know, have a normal conversation, right? You're breathing normally again. Yeah. And so even someone like that too, their heart rate's still up. So do you want to just take a seat for me, Quinn? Yeah. So even someone like that too, I'll probably get them to come over, and then I'll get them seated first. And then, you know, I might just be doing like some soft tissue stuff like this, kind of getting into the arm, kind of like mobiling it while I'm doing the soft tissue stuff, right? That pin and stretch kind of. And then I'll kind of get them down. And then after that, kind of their heart rates kind of calm down a little bit. Then I'll get them lying down on the table.
Lying face down?
Yeah, face down. Yeah, and then I'll kind of start with, then we're doing the opposite, remember, right? We're bringing it the other way. So we're going with the shaking, we're going with the jostling, we're going with the fast stuff, and then we start to bring it down. We start to make it a little slower, right? Things like that. And then from there, now we can get into like our deeper techniques, because we brought them down, we brought the heart rate down, and then now we can kind of get into the deeper stuff, right? Getting a little bit slower, a little bit deeper. And then from there, that's where it's like, boom, okay, now all your kind of traditional stuff is acceptable, okay? So today is more about so what we're gonna do today is we're gonna get into partners, try and give your partner, like, you know, maybe use some of your real life experience, like if you play a sport, give your partner a scenario and see how they can go with it. And today is more about, try not to get focused on the specifics, it's more about structuring like the rate, rhythm, that kind of stuff, okay? And if you, also too, we do like as the course goes along, we do have a bit of free time. So if you guys ever want to see like, oh, how do you release subscap? How do you release psoas? Like, start thinking about those things so I can show you those things as well.